This is a special Morning Mix segment.
I'm Todd Chance from the Fox 17 Morning Mix, and this segment is brought to you by Spectrum Health. Doctors are seeing a decrease in the number of cardiac patients coming into hospitals. We're on with cardiologist Dr. Ryan Matter, who can speak to why do you think that is, doctor?
Maybe I'll start with just speaking to what we've observed. We've seen in the United States about a 40% decrease in the number of patients that are showing up to hospitals in the midst of having a heart attack. And that is very concerning to us because having a heart attack is one of the most deadliest medical conditions that exist, with a very high mortality rate. And it's very concerning to know that some patients are sitting at home with this condition and not seeking treatment.
Why do you think they're not coming in? Do you think it's a safety issue?
And I think that is one of the things that we suspect, that some patients who may develop chest pain and heart attack symptoms are actually too scared to come to the hospital because they fear that by coming to the hospital, they'll expose themselves to a COVID-19 infection.
Are people putting their health at risk here?
Yeah, so when it comes to heart disease and heart attack in particular, the longer that a patient waits to come in, the more damage will actually happen to the heart. Much of that damage will end up being permanent. And also, the longer that they wait, the higher their risk of death from the underlying cardiovascular condition.
But people who are suffering a heart attack, or maybe just have a chronic heart condition and maybe need some routine care, it is safe for those people to come to the hospital at Spectrum Health.
Yes, the right thing to do for all of those patients is that they seek medical attention immediately. We have taken a number of steps at Spectrum to ensure the safety of our patients as well as our physicians and staff members. So we are, for all employees coming to the hospital, physicians, nurses, staff members, everybody is getting screened on a daily basis before they enter the hospital to increase the safety for our patients that are here. We are mandating that all of our employees and physicians wear masks when they're in common areas and also when they're in contact with patients to decrease the likelihood that somebody that might be carrying the COVID virus would transmit it either to other staff members or to patients. And so we're taking a number of safety steps to try to do our best to minimize the risk of this infection for people who come to the hospital that don't currently have it.
Well, thank you so much for that valuable information. And from all of us stuck at home, please forward our big thanks to you and all of those working on the front lines battling COVID-19. We appreciate your time.
Yeah, thank you, Todd.